Now, I would like to know from you,
Okay.
would it be proper to think that a collective, if we're going to maybe put professionals together, health professionals, or healthcare professionals, to say, okay, look, come together, let's have a forum, let's have a position on this. How do we get the country to be on the alert, to be ready, to just in case? After all, Sierra Leone to Ghana, Ghana to Nigeria is just, well, it's speculation, but it can happen.
I would believe that such things are already ongoing because we have the emergency preparedness and response plan. Almost every state has it, especially a state like Lagos State that I believe that has an epidemiologist, a public health physician as a state epidemiologist. I do know that some of those things are already there as emergency preparedness plan for any kind of epidemic, where you have your outbreak investigation,
Yes,
and your response. Whether it's working optimally or not is another question, but to gather health professionals again to come and begin to discuss it, I think is a bit unnecessary.
at this stage.
At this stage, what I would rather say is let different groups, states, federal level, go and relook these emergency preparedness plans and go and relook their epidemic investigation and outbreak control plans and make sure that it can run once that happens. That would be the best I would say. But to begin to call people together again, in my view, is unnecessary. Given, like I've said before, you must always assess your risk
Before you now take the next.
before you take action, because these things involve resources, and resources are limited. We do agree.
Yes, I agree, the limited resources.
Yeah.
But how far different is this from the crisis we had when AIDS and HIV/AIDS seemed to just be, well, the terrible villain in the city? How far are we from this?
The HIV/AIDS and this, it will be like comparing onions and potatoes or something like that.
Right, poles apart.
Poles apart, because at the point that HIV/AIDS came in, it had different ways of being transmitted. It has some sort of a chronic cause. Okay, so we are not really talking about the same thing. It took people a long time to even understand what was going on, and the factors surrounding the transmission of HIV/AIDS made people to go into their closets and withhold information, and then the issue of stigmatization came about until when people were able to overcome some of those things and made it a right-based thing and all that. So it is really, for Ebola is acute. There's actually no carrier state. The onset is always sudden. It's just that
before
way.
you know
So
it.
yes, so you wouldn't expect the same response as for the HIV
Okay.
AIDS situation.
Because I think the
Yes.
HIV/AIDS thing was caught with the sex mythology and all that, so
Exactly.
everybody just got a little bit angry and all that.
Angry.
But now, but you said something about not knowing immediately if it is Ebola or something else that you are treating, because it is not specific. Some of the symptoms you described could have been ordinary malaria, could have been typhoid, could have been, I mean, just so. What should people begin to do when somebody just, well, suddenly ill, and then you probably want to do the first thing Nigerians do. You go to the nearby, young man there and say, "Okay, give me anti-malaria or something."
Anti-malaria. The first case will usually be the one that will take people by surprise, because it would have come in from somewhere, but then we've also said that it's something that has a high case fatality rate. So it's something that just happens. But the good thing really, well, I don't know if I should use the word good, during the incubation period, it can be transmitted. Yes. It is when symptoms begin to manifest. Because remember, the way, I keep going back to the way it can be transmitted by the body fluids, semen, and all those things. So it's when those things begin to be available in those things, people begin to vomit and all those things that can then begin to get infectious. So what people need to know is once somebody becomes ill, do not self-medicate. Yes. And if you must take care, at least the person is ill at home, you have to take him, or maybe clean up whatever is there, and then take the person to the hospital. All through that process of taking care of the person, protect yourself. Wear gloves. Don't feel anyhow that, oh, I'm taking care of my brother, my sister, my child, my husband. It will look somehow if I do not put on a glove.
Please put on a glove.
Please put on a glove and do that. And quickly go to a
medical
health facility. And then that brings me to an even more important thing now. In Nigeria, I will not deny the fact that people patronize
herbalists,
yes, traditional birth attendants, yes, all those people. So we mustn't shun them at times like this. Because the important thing is I want to make sure that we control the transmission. We want to break that chain. So they must, if for any reason, remember, this is if,
yes,
yeah,
yes,
the information should be out there, that when people begin to come to them with things like this, they must protect themselves and then know that this is what they must
do.
Send people to health facilities. And most importantly, they themselves alert the health facility that we are seeing this in our community. It is actually very important.
Yes, they should cycle back and
yes,
report to the health facilities.
And
I attended to one man
to
that
the local government, whatever, whichever one that is closest to them, whoever that they can like easily get to in the formal sector, quickly get that information. This is beginning to go on in our community because it's something that if it's picked up early, then emergency response can be deployed. And then there are also NGOs and other international bodies can quickly come in and begin to offer assistance.
Some
like
mediation.
They're doing, at least they could offer lab services, like in Guinea now where they're doing, some lab services are being offered from France, from all sorts of places, to at least basically know first of all that what we were dealing with is this.
Okay, now that is something that also that seemed to be, if I may borrow this expression, as to be superintendent of everything that we do in terms of our health delivery service in Nigeria. Do we really have this kind of support system, going on in the health delivery service? Do we have a relationship, some kind of cordial relationship between the orthodox practice and the unorthodox?
Cordial is, how do you quantify it? That's one. It's difficult to quantify, but in terms of a relationship, I do think that there is to some level, especially people that understand public health practice. They do understand you have to always engage these people at some level because there are so many determinants of people's response to a disease condition. The way people understand their health has so many, there are just so diverse things that determine how people take action when they are not well. And the sociology of it all is complex, a lot of cultural things. And as public health physicians, we understand that. So we do not necessarily shun. We accept it, we understand it, we may not necessarily accept it, and then try to work towards it. So you see, there's been at different levels some training of traditional birth attendants to, at the very least, not infect people that come to them. The same universal precautions. Use protective equipment. Do not reuse razor blades. Simple things like that.
Yes.
All right? Simple, very, very simple things like that too. So that's why I say when you say cordial relationship, it's difficult to
quantify that.
To quantify it.
But the level of cooperation, you think, is increasing now? As compared to what we used to have when the traditionalists were kept just where they are, and they are readily available to the people, and the people would rather go to them rather than come to the modern medical facility. What do we really have now?
What we have is a system where we are trying to strengthen our primary health care services. Because at the end of the day, that is what we have accepted as the philosophy for healthcare delivery in Nigeria. The unorthodox, as you put it, are still there. What is the challenge really is that it is highly unregulated. It's not regulated to a very large extent. The very, very little evidence base for the things that go on there. Yes, and it is not appropriate in healthcare delivery that you do not audit what you do from time to time to see whether it's having the desired impact. You must always leave room for improvement. You must subject what you're doing to some sort of appraisal. You must subject whatever you're doing
to some questioning.
And that is where it's a struggle to find a nexus between the two, because as people in orthodox medicine, we are always striving to improve our practice. We are always striving to make sure that what we are doing has a sound scientific evidence base, and therefore we constantly audit, we constantly, at different levels. Yes, Nigeria may not be where
it should be.
At people, different setups, they are working towards improving practice. And that is why you can't put all of us in one bowl and we're all just so happy together.
That is still a dream.
Yes.
That is still a dream.